hacks about applying and using the Everel Conti Patches. These patches are typically given to postmenopausal women who still have a womb. The Everel Conti Patch contains estradiol at 50 micrograms, which is absorbed over 24 hours, and the progesterone component is norethisterone, which is absorbed at the rate of about 170 micrograms over 24 hours. Now, this is used for postmenopausal women, so 12 consecutive months without a period, and then we use the estrogen and the progesterone component, which are combined in one patch to give you your estrogen and as well as your endometrial protection with the progesterone. That is all in one single handy patch. The first hack is make sure you're on the right patch, because if you're postmenopausal, then ideally you shouldn't be bleeding. This has got estrogen and progesterone in it, so this should hopefully not make you bleed. However, when we start any HRT or do a dose adjustment of any HRT, it can be considered normal within the first 3 months to have a bleed. If that happens to you and you're postmenopausal, just flag it to your doctor to let them know that you are bleeding and what your bleeding pattern is like. These patches you apply to the skin below the waist, typically on the thigh or the bottom. You change it twice weekly on the same day each week. Ensure the skin is clean, dry and hairless before application, and avoid applying the patch on the same area twice, because then that way you won't get any irritation. So move those patches around. Avoid applying creams, talcs or moisturizers before applying the patch. The other great hack is apply pressure to the patch for a few seconds to ensure that it adheres to the site properly. Don't just pop it on and leave it, because there is a chance that it can fall off. If the patch does happen to fall off, don't panic. You can put one on immediately if it's a dodgy patch or the adhesive isn't so great, and make sure you try and stick to your original changing schedule. Avoid applying the Conti patches anywhere on or near your boobs. Also avoid any irritated skin, so cuts, spots or any itching on the skin or too dry skin as well. And avoid applying these under really tight clothing or elasticated areas, because it will just irritate your skin even further. If there's any residue adhesive that's left behind on any of the places that you've rotated your patch around, using baby oil can be a great way to try and take off some of that adhesive. And finally, the most question that I get asked, yes, the patch will remain on and should remain on during bathing and showering, so don't avoid those activities. And also you can exercise with your patches on as well. I hope that's been helpful. As always, if there's any questions, leave them down below.